Explained. Sinus tooth pain versus dental tooth pain. Is your toothache coming from your tooth or your sinus? When your tooth aches, you certainly want to know what is going on in your mouth, because that will help to resolve the issue. Sometimes the cause lies in the tooth itself, which may be decaying, or in the surrounding tissues, which may be inflamed. In other instances, the cause may be found nearby in your face, namely your sinuses. Whatever the cause, the solution comes from making sense of it for your personal understanding of the situation, as well as being able to describe your symptoms properly to your dentist or primary care physician. What is sinusitis and how does it differ from toothache? Sinusitis is inflammation of your sinuses, which can result from allergies or infections such as the common cold. Your sinuses are hollow areas in your face bones which are lined with membranes. When the linings are irritated, they become swollen, and the sinuses become blocked. This may cause accumulation of secretions in the sinuses. This causes the familiar sensations of having a clogged and heavy head that you feel when suffering from a cold or flu. What is the common ground between sinusitis and toothache? Since the sinuses in your cheekbones are directly above your upper teeth, sinusitis can cause pain in your teeth in different ways. One way is that the swollen sinuses put pressure on the roots of the teeth, which may come into contact with the sinuses. Another way is that the sinus pain is referred to the teeth. This means that the nerves supplying the sinuses and the teeth are common, so that a painful sensation in one nerve area may be carried by the nearby nerves as well, so that the pain appears to be felt in your teeth instead. What are the differences between pain from sinusitis and pain from a bad tooth? The most important thing is to be able to pinpoint where the pain is coming from. This can be done by evaluating the nature of the pain. If the pain comes and goes, it points towards sinusitis. If the pain is more or less constant, it means that it originates from the tooth itself. If the pain is greater sitting up than lying down, that may indicate sinusitis as the cause. If biting down on a particular tooth causes pain in that tooth, the toothache is probably localized to that tooth and is not coming from your sinuses. If you have a toothache as well as a headache first thing upon rising in the morning, it may be because of bruxism, or tooth clenching during the night. Sinusitis may be accompanied by other symptoms such as fever, congestion, sore throat, headache and cough, whereas a toothache is usually on its own. In any case, your dentist will be able to assess your case in the best way with the appropriate evaluation methods such as X-rays. Which teeth can be affected by sinusitis? Sinusitis can cause referred pain in both the upper and the lower teeth. In the situation where the swollen sinuses are putting pressure on your upper teeth and making them shift in position, the changed bite may cause pain in the lower teeth as well. While it is a good thing to be able to describe your symptoms as best you can and be as informed about your condition as possible, leave the final verdict about the true nature of your toothache to your dentist. What is the solution in either case? If the toothache is because of a tooth-related problem, it will be treated by your dentist. If it is because of sinusitis, you will be referred to your primary care physician, who will treat you for sinusitis. Your doctor will advise you to use antihistamines and decongestants to drain the fluid from your sinuses and relieve the pressure, therefore decreasing the pain. If there is an infection, you may be prescribed antibiotics to deal with it. If you go to your dentist with both occurrences, that is, a decaying tooth as well as sinusitis, it may be that symptoms from the two conditions overlap. In this case, it is vital to provide the correct medical and dental history so that it can be determined where the pain is coming from, as nobody wants to resort to unnecessary dental procedures to take care of non-dental problems such as sinusitis. Home remedies for sinus-related tooth pain. There are some things you can do to alleviate the pain until you see your doctor or to add to the system of therapies being used to heal your sinusitis. Steam. By taking a hot shower or inhaling steam in the proper way in order to open up your sinuses, you can get the relief you need. Just make sure to do it correctly by leaning over a container of steaming water and breathing in the steam. Be careful when you handle hot water, you don't want to get burned. If you want to avoid handling a container of hot water, you can wet a washcloth in hot water and apply it to your nose and cheeks. Be sure to do this several times a day. Drink enough water. Being dehydrated is not going to help you, especially when it comes to a condition like sinusitis. Drink plenty of water and make sure to take the electrolytes that you need. Remember, if the pain is not relieved after a few days or after using over-the-counter decongestants and nasal sprays as well as home remedies, it means that you should consult your doctor or primary care physician as soon as possible. It may be that you have both sinusitis and tooth decay, or that a dental cavity has progressed to become an abscess which is causing you pain and not responding to treatments which are intended to relieve sinusitis. In any case, seek professional dental and medical care and see your dentist regularly for the proper upkeep of your dental and oral health.